morning, everyone. Okay, how are you guys doing today? Still good. Fine. This in the morning still fine, right? Okay. Yesterday we learned about study design. You still remember something? What kind of design that we learned yesterday? Processional, cohort,
Case study, case control.
case series,
series.
what else? Case study and correlational study or ecological study. Okay, I hope you still remember something from yesterday. Okay, all right. So for today we're going to learn about the experimental study design. I think this type of design you are most familiar with from your previous experience, right? Okay. Before we go to talk about experimental study design, can you describe me a little bit about your project in undergrad? Okay, you because most of you mentioned that you use experimental study design, right? Can maybe some of you give me some example. What kind of research that you did? Okay, do you have any randomized control? How did you random the subject? Something like that. Okay, who would like to share your experience? Maybe one or two of you. You? Would you like to share?
In my undergrad, I do research about effect of home-based exercise program in joint health impairment แล้วก็ and functional limitation in children with hemophilia. So the randomized process we do permitted block because we has age from 8 to 18 and different severity of children with hemophilia. So we separate by permitted block and do stratified randomization.
Okay, first word, stratified randomization from your friend. Okay, and then after that, how did you do?
After that, I assess for week 0 to assess baseline of the patient and give home-based exercise program. And after 6 weeks, in 6 weeks, I follow up every two weeks by phone. And in the week 7, we made an appointment with the patient to assess the post-experimental. Yes.
Okay, what is your dependent? What are your dependent variables?
Dependent variable is the joint health from HJH and functional ability and physical activity from PET hall and quality of life participation from chocolate.
Oh, a lot of variables.
Yes,
okay.
from ICF, we do from ICF model.
Okay, what about independent? What kind of intervention that you gave?
It's a home-based exercise program. Its exercise consists of stretching, strengthening by functional strengthening, use the therapeutic band and balance training.
Yes. Do you have any blinding?
Yes, by assessor.
Blind assessor. Okay. Are you familiar with this term, blinding? Yes. Okay. How many of you are not too familiar with the terms blinding, double blind, single blind? Are you familiar? Yes, familiar. Okay, good. Thank you. Okay, one more example, please, from your undergrad. Any other example in Indonesia?
I did cross-sectional study at Johnson.
Cross-sectional study.
Yeah.
Okay. Who else conducted experimental study design? That's it. Okay, I think he's not here yet. Okay, that's okay. We will hear from him later on. Okay. All right. So for the experimental study design, okay, we will talk about this part. Okay, experimental, we have both randomized control trial and non-randomized control trial. Okay, let's take a look at the experimental study design. Okay, experimental study design is the study that the investigator or the researcher can control the intervention or the condition that you want to give to the participants. Okay, and for the experimental study design, because the researcher can control intervention, it is sometimes called we manipulate it. Okay, manipulate it, and we observe by measuring the dependent variables. So in your friend's example, she measured a lot of dependent variables, okay, based on ICF model. Okay, so here are some examples of interventions. Interventions that commonly give to the patients would be treatment, rehabilitation procedure, diet, exercise, and also we also have to consider about treatment regimens, like how many times a day, how many days a week, okay, how many weeks per month, something like that. Okay. All right, so in order to conduct the experimental study design, okay, there are something that we have to concern or try to minimize it, okay, okay. Maximize it actually. Internal validity and external validity. Okay. For the internal validity, it means that the researcher can control the condition and intervention and make sure that the result that come from this study actually come from your intervention. Okay. Internal validity means that the independent variable, so cause or the outcome or the condition that you give to the patient, okay, are the cause or the sole cause or the only cause that can change in the dependent variables, okay. And for the external validity, it means that your result can be applied to the real world situation, okay, can be generalized to other population. Internal and external validity. So in order to control that, you have to consider about threats that may happen during your data collection. Okay, the first one we will consider about threats to internal validity or the factors that might affect to your internal validity. Okay, the first threat is history. Okay, history, for example, events that occur between the first and second measurement. For example, in your friend's study, she studied at conduct assessment at baseline and conduct assessment at 2 weeks.
Week 7 after 6
Okay.
weeks.
Okay, 7 weeks.
Yes.
Okay, at week 7. Okay, so during baseline to week 7, anything can happen. This is called history. Okay, the researcher cannot control over that conditions. Okay, this is called the history, which is the threats to internal validity. It means that anything that happened in between that time can cause something change to the result of your data collection. Okay, here he is. So we will hear from him later on about the randomized control trial. Okay. Okay. All right. The second threat to the internal validity is we call the maturation. Okay. Maturation, it means that sometimes the condition of the subject is getting better by themselves. Okay. It's over time. So for example, if you have low back pain today, and if you take a rest by yourself, you don't have any intervention or treatment. Sometimes it's getting better by themselves. Okay, this is called maturation. Okay, or sometimes if you plan to collect data for the whole day long. Okay, in the morning, subjects still fresh, just like you today, this morning. Okay, but if you keep collecting data, okay, they have to sit in the experimental room for the whole day. Okay, so the result from the morning and the result from the evening may be different, just because they are fatigued. Okay, this is called the threat to your internal validity in terms of maturation. Okay. The next one we call the testing effect. Okay, it means that the effect of taking tests on the outcome of taking a second test. For example, if you're planning to take a test, maybe series of tests, like doing the 3-minute step test, and then after that you will test for leg strength. Okay, so this one will affect because the patient already fatigued from the first test, so the second test may be the result from the first test. Okay, so in order to avoid this, you have to planning the order of the test or having provide them some resting period. Okay, all right. The next one is the instrumentation. Okay, we call the threats to internal validity in terms of instrumentation. For example, if you have many instruments, okay, and many observers, okay, it may produce some result that not reliable. Okay, so how would you prevent this one in terms of instrumentation? If you have many observers or many researchers conducting in your research, how will you try to prevent these threats to your data collection for the instrument? Standardized. Okay, standardized assessment protocol. Okay, what else?
ขนาดเม็ดเดียวยังมี reliability between the assessor
Okay, testing the inter-rater reliability as well as intra-rater reliability, just like the project that you plan to do. Okay, in terms of instrument itself, you have to calibrate the instrument. Okay, or if you plan to use the questionnaire, you have to use the valid questionnaire. All right. Okay, the next threat to internal validity is called selection of subject bias, sampling bias. Okay, so if you use convenience sampling, it may cause the sampling bias. Okay, so in your friend's case, she used the stratified random sampling. Okay, it will help to reduce this sampling bias. Okay, next one, for the threats to internal validity, we call mortality or sample attrition. Sometimes if you conducting longitudinal study design or follow-up study, okay, in the between time that you conducting your research, maybe some patients die during that time, okay, or maybe they could not participate in your study for the whole period of time. They may move to another province or they move to another cities. Okay, so this is you have to consider, all right. And the last one we call the John Henry effect. Okay, John Henry effect. For example, if the subject in the control group find out that they are becoming comparing to those who are in the experimental group, they will try to work harder. Okay, these threats named after Mr. John Henry. So Mr. John Henry at that time he was the worker in the industry. Okay, and during that time they would like to compare between machine working and the human working. So he found out that okay, he's gonna be compared with the machine. So he tried to work hard in order to compete with the machine. Okay, that's why the result from that study is not exactly what his performance actually is. He's trying harder. Okay, just like when you conducting an experiment and you have control group and experimental group, and if those people who are in the control group find out what the experimental group doing, okay, they might try to do the same thing and work harder. Okay, for example, in the control group there is no exercise. In the experimental group, you give them some exercise. Okay, and you might talk to your friend that, oh, what did you do? Okay, what did they give you? And they will say, okay, I did this exercise and I feel much better. Oh, okay, I will do that too. Okay, so when the researcher conduct the assessment for the baseline and the follow-up assessment, the result may be not the same. Okay, in the control group and experiment. Alright, those are the threats to internal validity. The next one that we're going to take a look is the threats to external validity. So what it is? External validity, what does it mean again? Yeah, the result can be generalized, okay, or can be applied to the real world situation or other population. Okay, so the first threat to external validity is the reactive effect of testing. Okay, just like in the previous one, a pre-test might increase or decrease subject responsiveness to the experimental variable. If the subject has gone through some series of tests, okay, that the result from the series of tests might affect. Okay, when you measure the outcome of each test. Okay, so you have to consider again the order of the test might affect to your result. Okay, the second one, interaction effect of selection bias. Okay, this is once again in order to avoid this selection bias or sampling bias, you have to consider about random sampling. Okay. Okay. The third threat to external validity is we call the reactive effects of experimental arrangement. Okay, arrangement is it is difficult to generalize to non-experimental setting if this effect was attributed because if you trying to control everything, okay, just like in the setting room, okay, trying to control the temperature, the air condition, the flow of the air, okay, the result from the control room cannot be applied to the real world. Okay, so beware of this one. Okay, reactive effect of experimental arrangement. If you put too much control in your study, the result may not be able to apply to the real world situation. Okay. The next one, multiple treatment effect. Okay, in this case, if you try to test for everything, for example, you would like to test the effect of ultrasound plus laser plus what? Shock wave. Okay, for example, okay, you put all of this intervention in at once, okay, in order to see whether it can reduce pain or not. So at the end of your experiment, you will not be able to differentiate the effect came from which instrument. Okay, so when you try to design your own study, try to not to put too much everything together at the same time. Otherwise, you will not be able to say what the effect came from which one. Okay. All right. So those are the threats to internal and external validity. Next one, we will take a look at what we will consider as a true experimental study design. Okay, true experimental study design. It should have three components. The first one, we should have manipulation of independent variables. Second one, it should have control group. The third one, it should have randomization. Okay, we will consider as a true experimental design if we have all of these three components. Okay, I think you already familiar with the term manipulation. Okay, manipulation of the independent variable. All right. So let's hear from your friend. Okay, please hear. Earlier I asked for some of you who conduct some RCT or experimental design to share your experience. Okay, what type of design you did and how did you random the sample and what are your independent variables. Okay, can you still remember? Your friend already share hers. You still remember something?
Okay. I will research as a RCT. The topic is about the TMS and neuromuscular exercise in PD, in Parkinson's disease patient. So the first independent variable, okay, I will compare about the TMS, RTMS, something like that, and the sham TMS, and through dependent variable, the outcome that I will measure, I think about the part of outcome of team S, like MEP, SICI, something like that, and the clinical one, the balance or get speed. Okay, I think to randomization the group, I think use a computer randomization.
Okay. เรา sampling ยังไง sampling how did you sample the patients who come into your study convenient sampling or purposive sampling or stratified randomized
Our sampling, I'm not confirmed.
you're not sure okay alright okay thank you alright so I think in your case maybe convenient sampling because the patients right yeah it may be difficult for you to stratify okay alright thank you so in his case he manipulate TMS by comparing TMS dose and sham okay the one that you would like to test for the effect and the sham means that maybe you did not turn on any electricity yeah. okay so you can manipulate alright okay in terms of control group do you have control group in your study or just patients
The patient.
just patients okay just patient and the one who receive the TMS dose will be considered as experimental group and the one who has received the sham will be the control group okay all right so the true experimental design you should have control group okay for the control group subject in the control group receive no experimental treatment or any intervention at all so in his case the control group will be the sham group okay who did not receive any TMS treatment okay last one randomization okay it means that every subject has equal chance of being assigned to experimental or control group he did mention that he used the software right software to randomize okay randomize the patients into the group experimental group or control group okay for the true experimental design, as you can see that it consists of experimental group and the control group. The experimental group are the group that received the treatment or intervention and control group are the group that did not receive the treatment or any intervention. Actually, there are many methods of randomization. In your friend case, he did the computerized, okay. Maybe, but in the old days, you can just flip the coin, head or tail. Okay, if head, okay, group A, tail, group B, something like that. Or maybe drawing the lottery, something like that. Okay, just drawing something of group 1 or 2. Okay, you can use those methods to help you to randomize the group. Okay, so for the best experimental design. Okay, other than having the control group or comparison group, you should have inclusion/exclusion criteria. Okay, and also have assign random allocation. And other thing to add into this is that double blind. Okay, if possible, double blind would be strengthen your study design. Okay, and trying to avoid 3 C's. Okay, what does it mean by 3 C's? 3 C's stands for co-intervention, contamination, and non-compliance. Okay. For the first C, co-intervention. So during the time that you plan to conduct data collection, okay, maybe you have to inform the subject ahead of time that okay, during the time of the experiment, please try not to receive any other intervention. Okay, but after the experimental period, you can do whatever you want. Okay, for example, in your friend's case, okay, So he has to inform the patients that during the time that testing the effect of TMS, okay, during 1 month or maybe how long?
4 weeks.
4 weeks, okay, around 1 month. During the 4 weeks period, okay, trying not to receive any other treatment other than TMS in order to see the real effect of the TMS, okay, to avoid co-intervention. And for contamination, okay, for example, if you use an instrument like he did, you can control by contamination by what? How can you control for the contamination in the case of using the instrument? Contamination means that the control group know that what experimental group did, and they try to mimic to do the same. Okay, so if you use an instrument, do you have to concern about this? Yes. And how can you prevent it? To avoid contamination.
Separate rooms.
Separate room. Separate room over the cover the machine. Separate room.
Or made an appointment in different day.
Okay. Make appointment with different days. Okay, maybe it's easier to manage. Make appointment in different days. But actually for the machine, like this TMS, okay, the subject will not know. For example, for the sham group, they will not know. The researcher will apply just like the same as in the experimental group. Okay, so it might be easier for those who conduct with the instrument like TMS or ultrasound or laser, okay, because you can use the sham dose, okay, and the patient doesn't know which group they are in, okay. But it might be difficult for those who are in the home-based, like home-based exercise, okay, because they will know exactly what they receive, okay. It might be difficult for them for preventing the contamination. So in that case, yeah, you might have to like make appointment in different days in order to minimize this one. Okay. Last one, non-compliance. Okay, non-compliance it will happen if the patients will not adhere to the experimental protocol throughout the study period. So for this one, how can you try to prevent or minimize this non-compliance?
From my experience, we have follow up in every day of exercise in first 2 weeks, and after that, if we ensure that patient can do the exercise like not wrong, so we follow up in every 2 weeks, just 1 day in every 2 weeks, and we have logbook that the patient can write what time they exercise and all of the serious something that happened during the exercise period, something like that.
Telephone?
Yes, telephone.
Yes. And did you ask them to like video call with you?
Yes, video call.
Video call with you to make sure that they are doing the correct.
Yes.
Okay. Yeah, those are the way that you try to make sure that they comply with your protocol. Okay. All right. So now we will take a look at type of experimental design. Okay, that you can use later on when you study your own research. Okay, these are example of the experimental design. Okay, there are actually more of this, but these are the 5 study design that commonly used in our PT field. Okay, the first one, pre-test, post-test control design. Second one, post-test only control group. Third one, factorial design. Fourth one, repeated measure design. And last one, crossover design. Okay. Any of these design familiar with you? Are you familiar with factorial design? Factorial design? No? What about repeated measure? Repeated measure design. Yes. Okay. What about crossover? Crossover between limits. Okay. All right. Let's take a look. The first one we call the pre-test, post-test control designs. Okay. So this is actually when you conduct the RCT, randomized control trial. This is the basic structure of the RCT. Okay, which should contain of when you recruit the sample. Okay, you random the sample into experimental group and control group. Then after that you measure for the baseline, okay, baseline of both group, and then give them some intervention and measure for the post-test. Okay, this is the basic structure of randomized control trial because it contains of both randomized, okay, and have control group. Okay, that's why it is the basic structure and have both pre-test and post-test. All right. For this type of design, it will help the researcher to establish the cause and effect relationship. Okay, you can summarize or conclude that the effect of the intervention actually caused the change of your dependent variables. Okay, so the experimental study design you can establish the cause and effect relationship between independent and dependent variables. The second design we call the pre-test, post-test design. Okay, so in the pre-test, post-test design, the first thing you recruit the subject and you random them into experimental group 1 and experimental group 2. Okay, and then after that you conduct the pre-test, give them the intervention and post-test. Okay, for the pre-test, post-test design, okay, usually we'll use when the control group is not feasible or not ethical. Okay, can you think of any situation where if we do not give any intervention or any treatment to the patient will be unethical? Can you think of any situation? Any situation that we consider unethical if we do not give them any treatment? Cancer, if we do not give treatment, we call unethical. Okay. Anything else? Sorry. COVID-19. You mean vaccination? Okay. Actually, for in this one, for example, like the patients who are in serious condition, like in cancer, very serious cancer, okay, and if you do not provide them any medicine or any treatment, it may be unethical, right? So in that case, you will not have any control group. It means that at least the group that participated in your study should receive medicine that they will have, okay? So that's why for the pre-test, post-test design, this one will have no control group, okay? Because in some case, it is unethical to not to have control group in the study. Okay, the next one, post-test only control design. Okay, post-test only control design consists of recruiting the subject and then randomize them into experimental group and control group. Okay, and go on to intervention without any pre-test. Okay, and after intervention, you will assess for the post-test assessment. Okay, this design will be helpful when it is not possible to pre-test the subject. Okay, when it is not possible to pre-test the subject. When is it?
ICU patient.
ICU patient, yeah. What? How? For example, can you elaborate a little bit more?
Respiratory failure, and then we give them intervention, and after they become healthy again, we can post-test them.
Yeah, exactly. Okay, those who are in ICU, okay, and you would like to test for the intervention that maybe help them to get better. Okay, you cannot pre-test them. Okay, for example, okay, can you walk for me and see the quality of life or heart rate something? Okay, they cannot do that for you, but at least you can give them some intervention and then measure after that. Okay, so this design will be helpful for those conditions. Okay, post-test only control design. Okay. All right, the next one we call the factorial design. Okay, in the factorial design, the researcher will manipulate two or more independent variables simultaneously at the same time. Okay. For example, in this case, the researcher would like to see the effect of caffeine consumption and hours of sleep for the fatigue in the workers. Okay, so the independent variable one is the caffeine consumption. Okay, and then they divided into two levels: no coffee and 2 cups of coffee. Okay, independent variable 2 is hours of sleep. Okay, and then they also divided into 6 hours of sleep and 8 hours of sleep. Okay, and then they will find the main effect of the caffeine consumption and the main effect of hours of sleep. Okay, and in this factorial design can also help you to decide whether there is interaction effect between caffeine consumption and hours of sleep or not. Okay, so this design will be helpful if you have more than one independent variable to test. Okay, so in your research, in your future research, anyone planning to have more than one independent variable in your study? Future research. Not sure.
Sure.
Not sure. Okay. Not sure yet. Okay. So I think still most of you maybe still using one independent variable, right? Okay, that's okay. So in the future, if you plan to after you graduate, okay, you plan to conduct maybe continue for PhD, something. you can use factorial design. Okay. All right. Okay, this is as I mentioned that the benefit of factorial design, it will help you to determine for the main effect of independent variable 1 and 2 and the interaction effect. Okay, but in order to test for the interaction effect, you have to test whether your data is normal distribution or not. Okay, if your data is normal distribution, you can use parametric statistics to analyze for interaction effect. Okay, but if your data is not normally distributed, you may not be able to use the parametric. You have to use the non-parametric statistic, which might be less powerful to help you to detect for the interaction effect of the both independent variables. Okay. The next design we call the repeated measures design. Okay, for this design, it means that the researcher will recruit only one group of subjects, and this group of subjects will undergo two or more intervention. Okay, so recruit one subject and receive intervention and measure, receive intervention number 2, measure, and receive the intervention number 3, measure. Okay. For example, if you would like to find the effect of the design of the chair, okay, maybe recruit all of you guys in this room, okay, and the first chair will be this one. Okay, first chair this one, second chair will be the one that you sit on, and the third chair will be that one, for example. Okay, so all of you guys will come into this room and will undergo and sit on each chair, and the researcher might ask you for the comfortable level. Okay, so sit on the first chair, second chair, and third chair. Okay, if I ask you to sit on first chair, second chair, third chair in order like this, do you think it's a good idea? It's a good design? Everyone who comes in, first sit with this chair, second this chair, and third with this chair. Do you think it's a good design? Or should I change it? Change it?
There will be bias.
There will be bias, and how can I change it?
Separate the chair into each room.
separate the share into each group. Different days testing. But every day we will start with that one. The first one, the second one, third one, in order like this.
Blind participant.
Blind the participant. Okay, maybe you cannot blind the participant because the participants already know which one they say. How can you? You can random the order. Random the order. Like, okay, you come in, you will draw a slot, okay, and then okay, you pick one first. When number one, maybe second and third. Your friend come in, she might draw. Okay, this is the first one for her, second one for her, and third one for her, like this. Okay, random the order of the test. Okay, will help to reduce the bias and also the carryover effect. Okay, otherwise if you keep, okay, everyone sitting on that chair first. Okay, they sit for maybe 1 hour, and they may get fatigued already. Second chair, they may feel, oh, this chair is not comfortable at all. Third chair, oh no, it's not well for me. Okay, so this is called the carryover effect, like fatigue from the first chair, second chair, and third chair. So in order to prevent this carryover effect, okay, you have to random the order of the chair. Okay, so if you plan to conduct the repeated measure design, okay, you have to random the order of the test or the condition that you plan to give to the patient. Okay. You can see that in this design there is no control group, right? Because the subject act as their own control. Okay, because the subject, each subject will undergo each condition already, so they will act as their own control. This is called the within subject design. Okay, within subject design. Okay, the last design of the experimental study design we call it crossover design. Okay, so this crossover design, we will recruit sample, okay, and then random them into group 1 and group 2. So for example, if you want to test intervention for 1 month, okay, 1 month intervention, you can give the intervention for group 1 for 1 month, whereas the group 2 is the control group. Okay, which means that the group 2 will receive no intervention during that first month. Okay, and then after that you conduct pre-test, post-test, all right, and then after post-test, after 1 month period, you will switch. Okay, those who are in group 2 will switch to group 1. Will switch to be group 1 experimental. Okay, those who are in group 1 will switch to group 2. Okay, so group 2 during the first time will be the group 1 during the second time, and then for one month period, you will conduct the assessment, post-assessment. Okay, this is called the crossover. Okay, so both groups will have the chance to receive intervention, but at different time points. Okay, group 1 receive intervention at the first month, and the group 2 will receive intervention at the second month. Okay. But if you conducting the crossover effect, you have to be aware of the washout period. Okay, it depends on each instrument or each intervention. For example, for the TMS, okay, maybe they have some effect period, right? For how long the effect will last?
The effect is double of the treatment time. Like I put 4 weeks of TMS, so the effect is at least 4 weeks after that.
Okay, so it means that you have to allow at least 4 weeks during the washout period before you start the second period, the second round of the treatment. Okay, all right, thank you. Okay, so those are the 5 experimental design. Okay, and let's consider about what are the advantages of the 2 experimental design. It is the most powerful design, okay, to help you to establish the causal relationship, cause and effect relationship, okay, and it is much easier for other research to replicate the experimental and validated result, Okay, sometimes you will see during when you read or review the literature, you will see that some study doing the same method as in the previous one. Okay, we call it replicate. Okay, to make sure that actually it works. Okay, so for the experimental study design, it's easier for the other research team to replicate from the previous one. Okay. And because in the experimental study design, we control most of the variable as much as the researcher can. Okay, so the result may come as the researcher expected. Okay, because we control what we want. Okay. For the disadvantages, okay, the first one, the result from the experimental study may not be able to apply to the real life situation. Okay, and it may be difficult or expensive to set up. Expensive? Is it expensive? Very expensive. Okay. TMS. But in your case, maybe still able to apply to the real world because the subject still have to come in the room, right, and apply the instrument. But some intervention may not be able to apply in the real world. Okay. Okay. Here is an example of the manuscript, okay, that published. Okay. In this research, they evaluate the therapeutic effect of low-level laser in controlling low back pain, okay, a randomized control trial. So in this one, first you need to be aware that before you conducting the research, okay, especially for RCT, you need to register for the clinical trials, okay. Otherwise, it will be difficult to get published. Okay, this is a consort diagram. Okay, so for the RCT, you need to report. Okay, how many subjects that you recruit at the beginning. Okay, based on which inclusion/exclusion criteria. Okay, and how did you random? Okay, into group 1, 20 people, group 2, 20 people. Okay, and you also need to report loss to follow-up. Okay, why they lost follow-up during that time. Okay, and report how many subjects that actually ended up for your data analysis. Okay. All right. In this example, they use the single-blind randomized control trial. Okay, and use sham laser. Okay, so they blind the subject. Okay. Then they use the method of randomization through simple randomization table. So they just use the table to random the group of subjects. Okay. All right. So those are an example of the random true experimental design. Okay. Any questions so far for experimental design? No, not yet. Okay. So let's move on to another type of experimental design. Okay, we call quasi. Quasi with sometimes almost to be experimental design, but lack of some element. Okay, for example, maybe in your study design, lack of randomization, we also call quasi experimental study. And if your study design lack of control group, we also call quasi experimental study. And if you don't have any control or randomization, okay, we can also call the quasi experimental study design. Okay, here are some common design for the quasi experimental design that commonly found in our field. Okay, for the first one, pre-test, post-test, non-randomized control group design. Second one group pre-test, post-test design, and last one, time series design. Let's take a look. Okay. For the first design, pre-test, post-test, non-randomized control group design. So in this design, there is a pre-test, okay, pre-test and post-test. However, there is no randomized of the subject. Okay, just recruit the subject as in group A and control group, okay, and conduct pre-test, post-test. Okay, this is for the pre-test, post-test, non-randomized. Okay. And another design we call the one group pre-test post-test design. Okay, for the one group pre-test post-test design, you recruit the subject and then conduct the pre-test, give them intervention, and give them post assessment. Okay, so in this study design, the independent variable will be the time because all the subjects will receive the same intervention but different point in time. Okay. Okay, last one group time series design. Okay, for the one group time series design, actually this design is beneficial for the public health planning, for policy. Okay, for policy planning. For example, if you would like to have some policy that encourage the elderly to have more physical activity. Okay, so first you may have to conduct their quality of life, balance of gait, or falling rate. Okay, beforehand, like testing 1 to 3, maybe 6 or 12 months before you give them some intervention. Okay, just follow them during their own daily life activity. 1 year before you give them intervention, what are the quality of life, falling rate, etc. Okay, and then there is a period that you give them some intervention. For example, give them the physical activity education for maybe 6 months. Okay, and after 6 months of intervention, you will follow up with them for another 1 year. Like every month after that, you will measure for their quality of life, falling rate, etc. Just like before you give them the intervention. Okay, this is the one group time series. It means that you have to measure several times before you give the treatment. Okay, and after the treatment, you have to measure several times to see whether actually the treatment is actually effect. What do you think it is? Okay, so then you can issue the policy for the whole population later on. Okay. Okay, for the advantage of the quasi-experimental study design, okay, it is more practical and more feasible to conduct when compared to true experimental design. Okay, because it's not as controlled as in the true experimental design. Okay, and it is more suitable for apply to the real world situation and reduce time and resource. Okay, when comparing to the true experimental design. For the disadvantages, because it is lack of some control. Okay, so it might not be able to generalize to other population. Okay, and variable of the quasi-experimental study is less control comparing to the true experimental design. Okay, here is the example. So in this example, they study the effect of combination of 3D virtual reality and hands-on horticultural therapy on institutionalized older adults' physical and mental health. Okay, quasi-experimental design. So in this study, they conduct in Taiwan. Okay, Taiwan, and they actually pick on facility that they would like to be control group and experimental group. There is no randomization. Okay, so in this case, one facility picked as the experimental group, and the other facility also picked as control group. Okay, there is no randomized, so that's why we call it quasi. Okay, there is control group, but there is no randomization. Okay, now let's practice. Okay, I want you guys to work as group, maybe 3. Okay, we are work in this row or 3 groups, divided into 3 groups. 3 groups, and then try to design an experimental design. Okay, and when you design this experimental design, okay, first set the research question and objective of your research. Okay, then trying to identify independent variable and dependent variables. Okay, and lastly, choose the type of experimental design that you just learned. 5 types of study design. Okay, and try to if you talk about the true experimental design, you try to avoid 3 C's. Okay, try to think about how you can avoid the 3 C's. and whether you can blind the subject, blind assessor, blind the therapist or not. Okay, think about that. All right. So divided into two groups and discuss. Okay, you may choose one of your friends' future research as an example in this one. Okay. All right. Okay. It's up to you guys whether you would like to work in and role or you in this role. So maybe guys let's go to this one so that we can discuss it.
สามรอบ ติด
Maybe first you can share each of your future research and then you can decide later which one you will choose for this exercise.
เก้าอี้มันมันแบบไม่มีที่ใช่โอเค yeah I can type
Who is doing experiment?
yes you're doing
You do the so we choose yes.
This one,
You can choose your
this
you can
one
choose yours. Yes.
treatment.
Yes.
Okay.
Because cross sectional. Yeah. Cross sectional. Cross sectional.
yes
Cross sectional.
oh measurement
Mine is also analytical. So okay.
Yeah.
okay your topic yeah start with your topic first team is with
Team
still
and
continue for TMS you still using TMS
Okay, let's start first. So the method
start
so the
Give me the topic.
topic is
effect of
of
TMS
TMS
on TMS outcome
effect of TMS combined with neuromuscular exercise in
Neuromuscular exercise.
neuromuscular exercise in Parkinson's disease patient.
you have any outcome yet
I can say by MVP one and MVP and
so we can use effect of TMS as a
As the
outcome
alpha.
okay neuromuscular right exercise
And then we need the general objection.
the two group is have to exercise with neuromuscular
Oh, the
exercise.
control group.
oh
Okay.
But I think I not have I divide to separate to group. Yes, it's a TMS and sham. So the both group have
Oh.
exercise.
so the difference is just only
Only
TMS
TMS.
effect okay so that's why your outcome is only effect of TMS
So the other group is TMS. So this will be the control group. Like what the outcome? Outcome is effect.
effect of TMS it's like MEP that he said
Maybe SICI, something like that. And I think I will. I don't know. I will measure the tremor or balance, but now we can use only the TMS.
And SICI. So what's the design? Let's see.
maybe RCT is okay
RCT is okay, but
because we can blind
participant easy because they don't know that what they need.
And also we can blind
You could buy the
the,
assessor.
assessor.
Yeah.
So double blind.
Like if you are the assessor, I don't, but you are the therapist, and we can,
We can't blind the therapist.
yes, and we can plan for the assessor. So we
So we
blind.
can blind
have more than me
Yeah,
to
yes,
researcher. I can.
just an exercise of the brain. Like
So we can double blind.
double blind.
And
And
assessor.
how we double blind?
So since it's TMS and neuromuscular
Sharp.
so both group will think like they are receiving this right, but this will be done in a lab. So the population, the patients wouldn't know that the
TMS
experimental group
Yes.
is going through
Yes.
TMS, because the machine also can be like, separated through
Oh, yeah.
that, and they can just like
And then how we randomize the patient, like using what to randomize them.
they can just use computer.
Specify randomization
Certified, yeah.
Okay, right.
because it's not different in each Parkinson. Like for my hemophilia is different severity that can affect the outcome. So I use permitted box. Yes. But this one is okay, just
It's
specify.
okay.
Specify.
So we'll go from the beginning, like
Randomize.